This video is about donor preservation. Donor preservation means how can I protect your donor bank? When I talk about a bank, I don't mean your financial resources, I'm talking about your hair resources. Unlike your savings account where you can have more and more money if you save for it and you have compounded interest, which is a magical thing, hair is a non-renewable resource, which means that over your lifetime you have ongoing loss of hair. And the problem is it's a supply and demand issue, which means basically in the law of economics, you may have changes in supply and demand that go up and down, but in hair you have ongoing demand, which means ongoing hair loss, and you have ongoing reduction in supply, which means that either your crown is expanding into your donor hair or I'm stealing that donor hair with surgery. So what I'm encountering here is ongoing demand with ongoing reduction in supply. We never want that supply and demand curve to run out of supply to fix future demand. So when I look at you, that current snapshot, what I'm thinking about is where is your future supply to fix your future demand. And that is where 20 plus years of judgment that I have comes into play. And nowadays, as you've heard me decry, the industry is such that you're meeting with a businessman, a salesman to sell you a surgery, and people that should never have a transplant. And my goal, number one, is not to sell you a transplant, is make sure you're safe for a transplant. And number two, which dovetails into the concept of this video, is how can I protect your donor? So let's talk about that when I'm looking at it from an FUE perspective, and then we'll talk about it from a strip perspective. So when I do FUE, why am I so passionate that I, as a physician, am doing your harvesting? I'm not relegating it to a random person that may not even have a high school degree coming in here to do your harvesting. Because number one, they have no experience in what they do. Number two, they have no passion in what they do. Number three, it's also illegal. They have no license to do what they're doing. Number four is the fact that when I'm looking at this, I have years of experience to think, should I harvest this graft or should I not harvest this graft? Because when I'm looking, and this is why I've written 9 textbooks on hair transplant, I look and I think, every single hair that I take, should I take it or should I not take it? Because the hair must shingle over the next hair. If it doesn't, there's going to be a gap left behind. And I can tell you, I see over-harvested results that I cannot fix every week, and it's a total disaster. All right, total disaster. And I'll repeat those 2 words again, total disaster, where I can't fix it. You come to me too late. All right. Actually, I'll tell you another story. I had a gentleman last week, 23 years old, never should have had a transplant. He was sold a transplant by someone else. What I saw for him, he has what's called diffuse unpatterned alopecia or diffuse hair loss. So, well, does that sound like the story you just told in the other video? It is, but it's not the same guy. This is another guy who unfortunately had a transplant at 23. First, he should never had a transplant. Second of all, he had DUPA. He should never have had DUPA. You know what the technician, who I'm sure is not a surgeon, told him right before he had his transplant? They said, "Sir, it looks like you've had an FUE before." He says, "No, I've never had a surgery." You know why they thought? Because he already had horrible donor. They thought it was already over-harvested. I'm sure they're so used to seeing over-harvested destroyed donor, they thought, oh, here's a guy that I think he had sir, you had an FUE. No, if the guy actually was a physician that knew hair loss and understood what was going on, they would have known that he has diffuse unpatterned alopecia and should never be touched as a candidate, especially at 23. And he had his crown done. And his result looks artificial. And this guy is screwed for the rest of his life. So understand, no matter how sexy advertising marketing and no. So I'm getting off track, but I'm really not off track because donor preservation is the theme here. Donor preservation means how can we protect the donor hair? So that means looking at judgment of making sure not what is taken, but what is left behind. And so nowadays what's so sexy is 3,000 grafts, 4,000 grafts, 5,000 grafts, 6,000 grafts. This is what people are selling, the number of grafts transplanted. You know what's actually far, far more important than the number of grafts transplanted? This is why I don't charge per graft, is the number of hairs I preserve, all right? If you move 4,000 hairs and there's nothing left for me to touch in the next 5 to 10 years, there is no exit strategy for you, my friend. It's game over, all right? They don't tell you this. All you hear are the sexy numbers. How many grafts am I going to get? How many hairs are going to be preserved? Donor preservation is the key concept when you're researching a hair surgeon, not how many grafts are you going to transplant. You don't even know what 3,000 grafts would be. One of my staff who works here, the place he used to work, a chain here in Dallas, we won't mention where, you know what they used to do to get the numbers? When they quoted a patient a 3,000 graft count, they would cut those 2 to 3 hair grafts into single hair grafts so that they meet their numbers. Do you know what that does with 1 hair grafts? It causes destruction in terms of the survival because your sebaceous glands are all destroyed, and not to mention possible transection. Survival is lower and there's no density. Just because they want to meet a number, all right? I want you to get your head out of numbers. I want you to focus on donor preservation. And what you're going to be shocked at when you come in for a consultation, the first thing I'm going to do when I walk in, after I say hi to you, is I look at your donor hair. Because I got to see what's in the bank, okay? Not how much money do you, oh, this is another crazy story. Another staff member who used to work at another outfit or chain clinic in Dallas, a different one, I won't mention who it is, but you know what they would do, the first question they would ask the patient? How much money do you make? So that's disgusting, okay? Of course, you have to have enough money to afford my services, there's no doubt, okay? But that's the first question they want to know is how much money you have. But understand, and if you have enough money, they're going to sell you a transplant because that's the bank they care about. My bank I care about is this bank back here because that bank tells me everything about how safe you are and not how much money you have. If you can't afford it, let's not do a surgery, not a problem. But if you don't have bank back here, that's the bank I care about, the donor bank. So the next thing I want to talk about is strip in terms of preservation. We hear about all these horrible scars, these big, wide, nasty scars. My scars are really, really good where I don't think your barber will find it. In fact, most of the hairstylists and barbers send me the patients because my scars heal so well. Now, do I mean scarless? No, but these are the marketing terms, unfortunately, you hear online about, scarless FUE, scarless strips. These are all lies. Nothing is scarless. There's going to be a scar there. The goal is to make that scar very, very hard to see. Because if you leave a bad scar behind, I actually just did a consult for the gentleman out of another state that has a horrible scar where he's completely destroyed from a donor strip. Not only does he have a very, very bad scar there, okay, but his donor bank is destroyed. And that's the big thing is bad strip scars also destroy donor banks. Bad FUE over harvesting destroys donor banks. So my goal of leaving you a preserved donor when it comes to a strip is not only leave you a seamless scar, but that way it's not just so that you can cut your hair a little bit shorter, it's so that I have donor to come back to on a second pass, on a third pass, maybe on a fourth or fifth pass. Because especially if you're 30 or 40, I got to have enough in the reserve for your future issues. So this is a very sophisticated topic. There's no way I can cover all of it, but I want your mindset to stop thinking about how many grafts I'm going to get and how can I protect my donor.